Get your pills. Honest pharmacy. We are selling pills with side effects guaranteed.
My name is Chris van Tulleken.
Gastric bleeding, sir?
I'm a doctor looking for answers to a crisis in medicine that threatens us all.
It can erode your stomach lining and then you bleed from your stomach, and it kills a certain number of people every year.
Every year, doctors hand out over 1 billion prescriptions.
We're just prescribing more and more and more pills.
That's 15 courses of medicine for every man, woman and child.
You've got a headache, take paracetamol. Got a backache, take cocodamol.
That is an overdose.
Drugs do save lives, but this growing binge on medicines is dangerous.
How could this ever be good for a human being?
Millions of people suffer from side effects.
I was waking up depressed.
And thousands die every year.
Overuse of medication is one of the most serious problems that we face.
I believe there's another way.
Today is the last day that you are going to take these drugs.
Okay.
I'm going to take over part of a doctor's surgery, where I'll replace the drugs by treating patients without pills. From chronic pain to depression, but with worried doctors.
Stopping things can potentially be downright dangerous.
And patients who want the drugs I'm trying to stop.
Most of those pills do not work at all.
But they're painkillers.
Persuading Britain to go cold turkey could be the hardest thing I've ever done.
Intensely depressed about how to make a change.
Ah, my pills. Thank you.
Okay.
I've been a doctor for 14 years, and I'm increasingly alarmed by the steep rise in prescription rates. They've rocketed by over 50%.
So I've ordered bags of pills, and I'm going to try and work out how many of these things does a typical person take in a lifetime.
As babies, we're given essential vaccines and, more than likely, several doses of antibiotics.
And then the only other thing that a well 0 to 10-year-old is going to take really is drugs that reduce fever. So that's about 400 pills in there. That's like the number of doses of drugs a normal child gets in the first 10 years of its life.
All good, but by the time we hit our teens, it becomes utterly normal to pop pills on a regular basis.
1,500 painkillers.
From oral contraceptives to antibiotics.
That's around about 4,000 pills or doses. So there's the second decade of your life.
Things ramp up towards middle age.
So 20 to 50, what drugs might we take?
And at some point, it certainly wouldn't be unusual to hit a bout of depression.
In Blackpool, 1 in 5 people gets an antidepressant prescription. It's a staggering number.
As you reach 50, you might be taking 1,000 pills a year.
This is what we take from 20 to 50.
But things really get going when we hit our 60s, with a tsunami of drugs designed to prolong life.
Just 2 pills a day to manage that blood pressure.
In the course of a lifetime, a healthy person could easily consume up to 100,000 pills.
I mean, this is just a staggering amount of drugs. It's important to say that some of these drugs do good. They save lives, they make you feel better. But they can all do harm, all of them.
That harm comes in the form of side effects, from headaches to stomach bleeds. In many cases, they can be worse than the condition they're supposed to treat. I believe we should be turning to new research that suggests that many common illnesses are best treated without drugs.
I want to be clear, this is not some personal crusade against all medicines. There are drugs that benefit and save countless lives. But modern medicine has got to a point where we treat millions of people in this country with drugs that the science says don't work very well. For many people, they don't work at all, and they do massive amounts of harm. They kill people.
I'm going to work where more than half of the NHS drugs budget is spent, a GP surgery. But instead of handing out drugs, I'm going to take them away. I found a nearby clinic that's willing to let me test my theory.
Churchill Healthcare, Pat speaking, can I help?
Churchill Medical Centre is in Chingford, North East London.
Mrs. Collins.
Can you pop this in your ear?
The doctors here agree that overprescription is a serious national problem, and they're keen to see what I can do about it. But they aren't all convinced that I'll find answers by taking patients off their drugs.
Well, I guess the worst case scenario would be somebody died.
The notion that Chris is going to come in and just completely take people off drugs and then happily manage them without these things, I think is ludicrous.
It would be lovely to see if he could do it. I don't think it's going to be a walk in the park.
It's great. It's great, I'm here. First day at work, new school. Right. Hi.
The staff have gathered to hear my plans.
Thank you very much for making the time to see us today. So I guess what I want to do is set up a clinic within this practice where I will attempt with guidance and advice to stop people's prescriptions. It's quite a risky idea. What is your instinct about this as a problem, as a thing that needs addressing? Are you optimistic? Everyone's very poker-faced, I have to say.
So the principle behind it, you know, I don't think you're going to have anyone in the practice that turns around and says to you, no, I think that's a bad idea.
Oh, great. A bit of me was thinking, some of you might just think I'm mad. I mean, I've read all...
I didn't say we didn't think that.
Great.
It's going to take a while to convince them that I know what I'm doing.
So I'm not a GP. Being a GP is a highly skilled medical specialism, really, and I can't just turn up and do it unsupervised. So I've been given a mentor called Cam, who I'm about to meet, and it's a bit like going back to medical school. So,
Dr. Cam Sira is one of the practice partners.
Cam, hi.
Hi.
I'm Chris.
Cam, how are you doing?
Thanks very much for looking after me in advance. What do you think of my plan?
I would love for you to find some alternatives that are safe, that are viable, that we can carry through. But I am quite sceptical.
I think it's worth a go. I guess that's where I'm left.
Is she in any pain?
This is a busy practice with 14,000 patients and 15 full-time doctors.
Half night.
the drugs.
Yeah.
Last year, they handed out nearly 200,000 prescriptions. I'm hoping to help them cut the amount of drugs they give out and make changes that could be taken up across the country.
So we only have 10 minutes per patient, and in that time, you know, we're trying to address their the concerns that they've come in with. So it's quite a lot to be able to manage in 10 minutes.
Cam has suggested I start by watching him treat patients so I can see the problem for myself.
Hi.
Hi, come on in. How can we help?
I think I've got gout. It's really painful.
Gout is a type of arthritis that causes attacks of severe joint pain. The medication used to treat it can cause ulcers and, in extreme cases, stomach bleeds.
So we'll give you some naproxen, which is twice a day, which makes it easier for you when you're working. And we'll give you one stomach protection tablet.
All right, lovely. Thanks very much. Thank you.
Take care now.
Cheers, thanks. Do you think you could have avoided giving him those 2 pills?
Well, he's a builder. He's on his feet all day, doing, you know, heavy lifting. I think he needed those tablets.
It's pretty hard to argue with that.
Absolutely.
And those drugs were dispensed in just about the most responsible way I can imagine.
All the other bits. Come in.
I'm Chris.
How's it going?
Good.
Have a seat. Right, how can we help?
I need the dizzy pills again. I can't wake up in the mornings properly, it makes me sick.
How often are you vomiting?
Every time I'm dizzy.
Let's have a look at your good one first.
In just 10 minutes, Cam must examine the patient, find out what's wrong, decide the treatment to give and discuss it with them, all before the next patient arrives.
that's for a couple of months, okay? Hopefully it should improve.
Thanks a lot. Right? See you later, man. See you guys. Have a good day.
So do you think that giving him drugs was the right thing to do?
I mean, he's vomiting on a weekly basis, and that's not going to be healthy. So this, for me, something that's going to actually make him feel better, is an easy medicine to be giving.
As the day passes, I notice a pattern.
For now, we will give you some treatment, some antibiotics to treat this.
So more drugs, Cam?
Yeah, more drugs. If we don't treat him, he could die. We're trying to nip it in the bud, really.
I've got a serious ear pain.
So we're going to give you some a spray.
Steroids.
And antibiotics.
Every single person walked out of here with a prescription, virtually. Is that right?
When you're there in front of someone, you can cite all the evidence you like. They're still there and they're still in pain, for example. You still have to manage that. And it's very difficult to say, well, the evidence suggests that we don't treat you for this, and so we're not going to give you, we're going to carry on, you're going to carry on in pain.
No one could deny that he is a superb doctor. And yet, he saw 40 patients and he dealt out 39 prescriptions.
When you look at each one of those decisions, it feels like, well, yeah, that's okay, I'd do the same thing, but when you look at that big picture of everyone who comes in, walks out with drugs, that can't be a good thing. I can't quite put my finger on what's going wrong. To find out, I'm meeting one of Britain's most senior doctors.
Hi, Mia. How are you?
Good.
Oh, it's very nice to see you.
Sir Muir Gray used to be Chief Knowledge Officer for the NHS.
Overuse of medication is one of the most serious problems that we face in healthcare in every developed country.
How have we got to a point where we have too much medicine? How has it all happened?
We've got these 40,000 doctors sitting in a room with 10 minutes to get closure. We've got patients who we've led to believe that the solution is a prescription, and I've got nothing else to offer them. So surprise, surprise, how do we finish off the consultation? The pressure is terrific to finish the consultation with a prescription, and therefore we need a revolution. We need to change the way we think and need to change the way we do things.
You going to mug me?
Am I going to mug you?
Is that gorgeous or what, eh?
And I believe I can run a decent marathon.
Thank you very much.
Download Veely now.
Morning. Morning.
Good morning.
Morning, Morag.
I'm going to start my revolution by helping patients who've become victims of the system.
She's room 3, next door to Dr. Symmetry.
The surgery soon finds someone that they hope I can help.
Wendy, Chris Van Tulleken. Have a seat there.
Thank you. I've got a major problem with my shoulder. It just feels like my whole shoulder and my arm just feels like pins and needles in my hand. I can't pick anything up, I can't grip, it hurts.
Wendy's been taking painkillers for the past 20 years to deal with chronic pain in her shoulder and back.
Like sort of here, the pain.
Despite physiotherapy and referrals to specialists, her doctors still can't figure out what's wrong.
Okay.
She's now being prescribed increasingly powerful drugs.
What helps? Does anything help it?
Diazepam.
It's a highly addictive.
I really begged for them and they wouldn't give them to me.
It's quite dangerous.
Please
yeah.
give me more.
Yeah. The problem is you have to take more and more and more and more
Really?
and more to get that same effect.
Right, okay.
And it becomes extremely toxic. And then when you stop taking it, it's really dangerous.
Right.
Consuming these drugs long term could be causing Wendy real harm.
Thank you
It's
so much.
it's very nice to see you, okay? We'll be in touch.
All right.
Cheers, Wendy. Bye.
I want to help her find another way. Prescriptions for painkillers have shot up by nearly 50% in the last decade. They're now some of Britain's most commonly used drugs.
Wendy is the normal, right? She's taking stuff that's mainly over the counter, it's available to all of us, and it's the stuff we all take a huge amount of. And for the most part, it doesn't work very well.
A recent review of research into over-the-counter painkillers found many only work about half the time. I wonder if the painkillers are really working for Wendy. To find out more, I'm abandoning the usual 10-minute appointment and making an old-fashioned home visit.
Beware of the dog. Oh, hello. Who are you?
Jasper.
Hi. Hi, Jasper. Hi. I'm Chris. Thank you for having me.
That's okay, you're welcome.
And who are these guys?
Jasper and Boo.
Boo. Hi, Boo.
Wendy lives with her husband, Alan, and her daughter, Jade.
I feel like I want to go straight to your drugs cabinet.
Okay.
But let's not do that. Let's have a cup of tea. Let's have a cup of tea first. You've been off and on painkillers for 20 years for this.
Yeah, the last 2 years, nearly every day I've been taking painkillers. It's never really gone.
Are you in a worse state now than you were 20 years ago?
I'm definitely worse now than I was, definitely.
Right. So talk about the drugs. Where are the drugs?
Okay, so I've got my tablets in here if you want to see them.
We'll get it all out. Come on. This is the cupboard of shame.
Codes them all.
Wendy takes a daily cocktail of 3 different painkillers: paracetamol, ibuprofen and codeine. They're supposed to work by interfering with pain messages sent to the brain.
Can we lay it out? Do you mind if I pop out for the whole day, pop out the pills that you would have?
Yeah.
Okay.
Taking a cocktail of painkillers like Wendy does every day can produce more of an effect. But in cases where they don't work, patients can end up taking bigger and bigger doses.
And now we've laid it out, what do you think of that?
I know, I did think to myself, especially in the morning when I take that one as well, and I was thinking, oh my God, this is a lot of pills that I'm taking.
When you do take all of them, and because you're having a bad day, does all the pain go away? Are you completely better?
No, so basically it sort of eases off, and then I know it's 4 hours later and I have to take them again.
Okay.
I'm surprised at the amount of drugs you're taking. I didn't know you was taking that many daily.
That's only when I got a really bad back.
But then I've never seen you without a bad back. You can never walk through that door and say, oh, well, I've just had some drugs, my back feels better. Every time you come through that door, it's my back's really bad.
No, because I need to take some more drugs.
But you've just had some, probably.
No, I take them every 4 hours. I don't. Sometimes
exactly.
You told me, don't worry about 4 hours, 3 hours.
I didn't know you was taking that amount, though, Wendy. I didn't know you was taking. I didn't realise you. I thought you was taking 1 pill a day or something.
And I must
not
admit,
all that.
to be honest, I was taking 3 of them.
Oh my Lord, really? Sorry, I thought you meant you were actually only taking them 3 times a day. What you mean is you were taking 4 times a day.
Yeah.
That is an overdose.
I'm worried about Wendy's excessive drug use, and I want her to understand the dangers.
So ibuprofen can damage your kidneys,
Right.
especially at the doses you're having it.
Okay.
The paracetamol could damage your liver. So if you hurt your liver, we can't do anything. You either get a transplant or you die.
Right.
So the #1 cause of acute liver injury in this country is paracetamol overdose.
Okay.
The other thing I think I would really like to try and do to you is prove to you that the drugs don't work.
They're painkillers, so they must work. They get rid of the pain.
There's much pain, I believe, with them or without.
No, I'm in more pain without them.
That's probably a mental thing.
Are you saying that I'm
I think-
mental?
No, I think that's what...
No,
I just think that's what you're telling
it's in your
yourself.
head.
Because every
No,
4
it's not
hours
in my head.
you
The
need
pain
those
is
drugs.
real. I'm telling you that.
No. I don't dispute for 1 minute the pain is real. What I'm disputing, I don't think the painkillers are giving you as
helping
much
the pain.
relief as what you're saying or thinking they are.
Okay, Dr. Allen.
No, I'm just saying.
Would you be willing to let me just take away all the drugs?
If I can have another solution and get rid of the pain, then I'll be happy to do that.
When was the last time you went and saw a physio and did some exercises to help your shoulder?
I'll normally do like a sort of few stretches and whatever, and then you just forget about it and get on
On
with
an
the
honest
day.
note, how many times have you come to this house and seen Mum doing any exercises for her back?
I do them in the
You
bedroom.
don't. You do. You'll go along in the car and you'll do. This is when you exercise, right? So you'll be in the car and you go.
Yeah, she does that.
The truth is, Wendy,
No, when
you'd
you're
rather
not-
go and
no,
pop a pill than do an exercise.
When you're not here,
This morning, how many did you do exercises for your bad shoulder?
no.
Yesterday, did you do exercises?
No, I must admit. No.
She's done bugger all other than take pills. That's what I think. She's done nothing. She spent a huge amount on people poking and prodding and making that pain worse. And she needs to do some graft, some exercise. And the other thing is, those painkillers don't work. I thought, oh, maybe they do. Those painkillers do not work. I just need to think of a clever way to convince her to stop taking them. Wendy's pill habit is one part of a bigger problem. In my day job, I'm an infection doctor and a scientist, and I'm now facing the most terrifying consequence of our pill-popping culture: antibiotic resistance.
By overusing antibiotics, we generate antibiotic resistance, which spells the end of life as we know it on this planet. That is a doomsday scenario.
They're vital for treating and preventing bacterial infections. Without them, many medical procedures simply won't be possible. But we've prescribed them so much that the bacteria they should kill have evolved to resist them.
People don't quite get this. If we run out of antibiotics, it's not that we can no longer treat your, infected finger. It's that we can't do any more bone surgery, that we can't treat cancer. We can't run a hospital. You can't have an intensive care unit. You can't do anything.
Drug-resistant infections are becoming increasingly common in hospitals. Unless we cut antibiotic use and slow the spread of these new superbugs, it's estimated they'll kill 10 million people a year by 2050.
I'm calling from Churchill Medical Centre. One of our patients has written to us, sorry.
Catherine, you coming to the meeting? Yeah. Free sandwiches, yeah, in 2 minutes. Do you want to come to the antibiotic? Fine.
I've discovered this practice has one of the highest antibiotic prescription rates in the area. I've asked for a meeting to discuss what we can do about it.
I guess this is the first time I've spoken to them, and I feel like I'm going to fairly bluntly criticise them. And that's really uncomfortable, but I guess I do have the authority that I am an infection doctor. Phil, have a seat. Grab a sandwich. So of the 45 practices, you are the 9th biggest prescriber in the local area. I guess that begs the question, why?
I don't think we've got anybody who is very cavalier with their prescribing.
I'd say 99.9% of the time, they are appropriate prescriptions.
I do come from a position where I think we do, in general, overuse antibiotics. We probably underreport side effects, and resistance is such an enormous problem that we should take every step we can.
It's all very nice sitting in front and saying, you give too many antibiotics. I challenge you to come and sit with me in surgery. See the patients and see what you can do. And yeah, try and resist.
Fine.
Great.
I mean, how hard can it be?
This morning, I'm taking Cam up on his challenge. Nine out of 10 GPs feel pressurised to prescribe antibiotics. I want to see if I'll be able to resist.
Today's my first day as a GP, and it's very nerve-wracking because, of course, I'm not a GP.
Today, I'll be the doctor in charge, and Cam will be in the room in case I need help.
I think coming in with his own agenda, I think what he will really find difficult is patients have their own agenda, and when those clash, then that doesn't lead to a good outcome.
You ready?
No, of course I'm not ready. Am I ready? I'm not ready at all.
You've done clinics.
I've done clinics. No, I don't know why. This is not a big deal. I can see a patient. Right, here we go. Okay, why am I saying? Why's my mouth dry? My palm's sweaty. Okay, Nick Cairns. Right. Have we called him? Nick Cairns. What's up today? Why have you come to see me?
Well, I've had a sore throat. I generally felt pretty rough for about a week.
What do you feel you would like out of today's consultation?
Like antibiotics to just completely eradicate
Get rid of it, yeah. Okay.
Antibiotics only work with bacterial infections, but they can be given unnecessarily to patients suffering from viral infections.
It is a bit red. But there's no pus there.
This patient appears to have a virus which should clear up by itself.
I mean, I think you are just going to get better. This is going to be self-limiting, and in your case, antibiotics might cause more problems than they'll solve.
Yeah.
Is that all right with you?
Yeah, if you think I'm going to get better on my own then.
Great. Okay. Very nice to see you.
And you, yeah, thanks a lot.
It's my first success, and I'm feeling quite smug.
You know, I mean, that was a fairly simple case. Someone came in with a sore throat, and he was very amenable. And I'm sure the next one is not as easy.
Carla?
What's up?
Okay, well basically I've had an ongoing problem with my toe.
It's going to need reoperation. So what would you do? Give a course of antibiotics.
So what would you do?
Well, okay. Doesn't need antibiotics.
Even with many bacterial infections, patients get better over time without drugs.
Well, I guess I would wonder if this is actually going to go away with antibiotics. Bearing in mind you've got a lot of pus there, would I put a hole in the nail and see if it'll drain out?
Last time I believe I had a course of antibiotics, which helped really a lot. I start my placement as a student nurse in a couple of weeks.
Fine. There's no way you're going to be able to do that. So we'll prescribe some antibiotics.
Perhaps I should have held out, but the antibiotics may prevent serious complications.
Say R.
She usually gets better with antibiotics.
Camera at the back, can you see?
And when this mum wants antibiotics to help her child recover in time for exams...
So I'm very happy to give you antibiotics in this particular instance. Are you happy to hold that while I just have a look? Sorry.
Some bacterial infections can kill if not treated. And without a test to be certain it's not bacterial, I prescribe antibiotics just to be safe.
So we'll give some ear drops that have an antibiotic in. There is your prescription.
Thank you. The wheezing, I'm literally talking to myself with it, you know what I mean? Really bad.
It's the end of the day, and I come across a patient that I'm reasonably confident doesn't need a prescription.
There are risks with antibiotics.
No, as I say, like, I do need them. Okay. That's the way I look at it. But to just walk out with nothing, I wouldn't feel safe.
No, that's
what I'm trying to say.
97% of patients in the UK who ask for antibiotics are prescribed them. Unless you're certain the infection's not bacterial, it's the safest thing to do.
Thank you very much for your time.
All right.
Thank you.
I did not want to give him
Yeah.
a course of antibiotics.
Okay.
And I gave him a course of antibiotics.
And I definitely would have stepped in if you had said no. Someone with so many other medical problems, I would really be keen not to let them get any worse. Yeah, so that's what we're really, that type of patient is what you're really trying to deal with.
It's been a difficult day.
I feel I'm kind of all at once in awe of what has to be done in a day, and Cam, bear in mind, is still in there doing his stuff, and intensely depressed about how to make a change.
This drug problem can't be solved by just saying no. I'm going to have to think of a different approach.
Is that the only thing you needed? Can you do 3:30? Can I have a prescription for immediate?
I've found another patient. Sarah isn't registered at this practice, but she's heard about my work here and wants my help to come off her meds.
Sarah, come on in.
She's 24, and she's one of over 5 million people in this country who take antidepressants.
I've always just felt very low and very depressed and very uptight. And then when I got to 16, I went to the doctors and I got myself diagnosed with depression, and I got put on medication from that age to kind of try and level myself out.
Why do you want to stop your pills?
I feel like they mask everything. but they're not getting to any root of any problem. They're not really resolving anything long term.
Okay. What happens when you try to stop them?
I have really, really bad downs.
Okay.
And I don't really see any other way of stopping the downs apart from going back on the antidepressants.
It's thought that antidepressants alter levels of brain chemicals known as neurotransmitters, which can influence mood.
Have you ever read this?
Probably.
Okay, very common side effects. Headache, trembling, dizziness, palpitations, nausea, dry mouth, constipation.
They are powerful drugs and, in ideal circumstances, would only be used short term.
They perk you up, they get you through the crisis, the grief, and then you can come off them and rebuild your life. That is not the way they're being used in you. You've been on antidepressants now for 8 years.
It's not normal. It's not right.
Well, it is normal. It's completely normal.
Yeah, but it's
like you're
not.
like so many other people in Britain, but I don't think there's any evidence that these drugs are making you better.
No, I don't either.
These drugs can help people, but between 2005 and 2012, the number of young people prescribed them went up by over 50%.
There is something about giving antidepressants to a 16-year-old that makes me uneasy. Not that it should never be done, but talking to Sarah, it feels like, you know, at 16 you're developing, you're learning skills to cope with problems, and this was a time in her life where she could have been learning that, and instead she was put into what she describes as a chemical fog.
I'm on my way to see Sarah at home to find out how I can help her come off the drugs.
Hi, how are you?
Yeah, it's good. Come in. Come in, it's all right.
I guess one of the reasons to come round is there all kinds of clues that you get about someone from nosing around their house that you can never get, no matter how long we sit in a doctor's surgery for. If there's anything you're really ashamed of, that is the thing I most want to see. Go for it, go for it. You lead, you're in charge, Evie.
Come on. Yeah, we're coming up the stairs with you. Come on.
Pull the curtains, Evie. Let's do that. Yeah. You know, it's really, it's sort of, it's diagnostic of low mood, having a room like this. And if you didn't have a low mood, then living like this gives you a low mood because it's so stressful.
A lot of the clutter belongs to her dead brother, Ben. Both Ben and her father suffered from depression. They died within a few years of each other.
My dad was an accidental suicide, and with my brother, he was got highly addicted to drugs and passed away last year.
Everywhere I look, I see signs of a woman who's put her life on hold. Apart from Evie's room.
When she was first born, and when I found out I was pregnant with her, that's when I started to feel like, actually, yeah, I can do this because I need to do this. I've got somebody that needs me to be strong. You're going to be the centre of everything, are you?
Sarah doesn't want Evie to see her taking antidepressants or live with a mum who's depressed. And I really want to help her find a way out.
Okay, so what about stuff you used to do, like sport, hobbies?
I used to love going swimming. I used to be a good runner. Yeah, I've kind of really given up on hobbies over the
What
past
kind of,
few
when was
years.
the last time you went swimming?
A few weeks back for her.
When was the last time you did a bunch of lengths?
Years.
When was the last time you went for a run?
Years.
Sarah, I think, is someone who is tough, resilient, used to love things that are physical, is really social. So I think a treatment for her is going to encompass all those things. It's going to be challenging, it's going to be outdoors, it's going to be physical, and she's going to do it with some other people.
If this works, I'm hoping she can give up her antidepressants. I'm back in Chingford. I've come up with a way to try to convince Wendy to stop taking her painkillers.
So we've arrived at Wendy's and I've got a little test
as far as I'm aware, no one's ever really done before to find out if any of Wendy's painkillers are working. Maybe they work brilliantly well, maybe I'm totally wrong, but I've got a way of finding out. I don't know if Wendy's going to agree, but it's worth a go. Let's see. Jasper. Hi, Alan.
Hello.
Hi. Very nice to see you.
Hello, hiya.
Hi.
Nice to see you, yeah, good.
Okay, I'll be honest, from everything that you've spoken to me about, from all your stories, I don't think your painkillers are working. So I want to do a test to find out if they are working.
Okay.
I've worked out this test with the help of Wendy's doctors.
These are your pills
Right.
for the next 2 weeks.
Okay. Which ones are which?
So, in that blue tablet is a single codeine pill of 15 milligrams, okay? In each of those red tablets is half a gram of paracetamol.
Right, okay.
Okay. There is a twist with these tablets that
Okay.
I've laid out. That some of these tablets don't contain any medicine.
Right.
And you don't know
Okay.
which ones are real and which ones aren't real,
Okay.
okay?
But I will know because I'll be in pain.
Well, we'll see, won't we? That's the point. And I'm going to get you to keep a pain chart, okay?
Okay.
Wendy will use this to record her pain levels over the next fortnight. I want to see if she notices the days when she's taking tablets without any drugs.
But the only way of knowing if these painkillers work for you is to do this.
Okay.
Okay.
That's fine.
Are you happy to do this?
Yeah?
So the main thing I need to do now is take away all your other painkillers.
What about if I have a headache?
Well, you get a headache, best treatment, big glass of water.
Yes.
Okay.
Okay.
To make sure she doesn't take more than the prescribed dose, all the painkillers in the house must go.
Oh, I'm not sure what they are. Oh, they do, look.
It's been a bit interesting. I'm sure there's a load of codeine in them things, so I'll be fine.
Is this it?
No, there's some more coming.
Upstairs, yeah? Okay, this is from the upstairs.
Are you sure they're all?
These are all out of
No,
your...
I think,
these are all out of your
some
drawer.
of them might be my anti-dizziness ones.
Whatever they are, they're all out of your...
Oh no, they're my Sudafed. Yeah.
And remember, this is what you want to do, yeah?
Yeah. If pills
Just give us
are-
14 days. All right, everyone,
Bye. See you. Jasper. Thank you. Bye.
Night.
See you.
Toxic side effects in a bag, not in a patient. Very pleased.
Everywhere. Found in the bathroom cabinet, found them in your makeup thing. Got pills everywhere. I mean, you're such a pill freak. You don't need them. I was going to prove that.
I'm off to Portsmouth. I've heard about new research being done there that might help Sarah come off her pills, but it's extreme.
This is the one thing I'm doing with a patient where I think my colleagues who are psychiatrists will turn around and go, "What are you doing? You're a lunatic. This is barbaric."
I want to take her swimming in water so cold that it could kill you from shock.
This is the thing I do, and when I do it, especially if I'm feeling a bit low, my God, it's a pep up. But, so then when I looked into the science more, and I called a mate who supervises this activity regularly, he said, no, there's some evidence. There's some evidence it helps with anxiety, depression. So that nailed it.
Before I try this on Sarah, I'm going to visit my colleague to learn a bit more.
I'm here to see Mike Tipton.
How are you doing?
Very nice to see you again.
Good to see you, Chris.
Professor Mike Tipton is a world expert on the effects of cold water on the human body. He's going to demonstrate why it might be helpful for Sarah.
Essentially what we're going to do is demonstrate a cold shock response, the most dangerous of all of the responses associated with immersion in cold water. If you go through, get changed, and then we'll get you wired up and ready to go. You just need to push yourself back with your feet there. 3, 2, 1, go.
Mike's team have discovered that our bodies respond to cold water in a similar way to an anxiety attack.
Well done. That's good. Good effort. Okay, just stick with it, Chris. That's very good.
As the skin cools down rapidly, the body enters a state of shock, flooding the blood with stress hormones.
There's a sense of severe panic when you first go in. I thought I was prepared.
It's a big stress response. One of the biggest stresses you can put the body under. You can see why we called it the cold shock response. It's a shocking response.
It's deeply shocking.
Yeah.
I'm shocked.
This chemical surge can leave swimmers feeling euphoric once it's passed.
It is exhilarating.
You're now experiencing what every open water wild swimmer says. It's just great because it's that skin stimulation releases adrenaline and gets you, all your stress hormones shoot up, and it's kind of exhilarating. It is kind of exhilarating.
Hiya! You're right.
But there is another potential benefit for Sarah. The evidence shows that repeated exposure to cold water conditions the body to deal with the stress response. I'm hoping that this conditioning will help her respond better to the stresses in her life associated with her anxiety and depression.
We're going to go to a lake, a man-made lake, and just give wild swimming a bit of a go.
Sounds good to me.
You happy about that?
I'm excited but scared, but yeah, I know it's going to help, so I trust you all. I'm still very nervous now.
I'm slightly nervous about the cold.
If this works, I think she'll be ready to start coming off her pills. But it will be a challenge.
Here we are. Wow. It's really, really picturesque, isn't it?
The lake is cold and winter has only just ended.
What do you think? You up for this?
I'm up for this.
Great, okay.
I'm ready.
Let's go.
I've asked Mark and Heather, cold water swimmers, to come and support Sarah.
Put up to our shoulders.
Just so you're breathing out first. And then we'll do to the other end breaststroke.
Okay, lead me in.
That's all you've got to do. Well done. That's excellent. You all right?
How you doing?
I'm not.
Get this one.
Go for a swim. I needed that.
So how you doing?
I'm brilliant.
How's this?
Amazing.
I thought we were just going to do one leg.
No. Carry on.
Oh.
You all right?
The therapy seems to be working.
How do you feel, Sarah?
On top of the world.
Yeah, and why do you feel on top of the world?
I've done what I came out to do. And I've done it well.
I'm blown away. Completely. Mind blown.
Good. I feel amazing. Still cold. But
As well as the euphoric boost, swimming regularly will give Sarah exercise, which is recommended as an alternative treatment for depression by the NHS.
Fantastic.
It's still a bit odd to me that we did 4 lengths in there.
yeah, and if I saw someone jumping now, I'd still think,
Oh,
you're crazy.
they're going to be rescued. Yeah.
But no, it's great.
So over the next 4 weeks, I'm going to say, I want you to go swimming 6 times, okay?
Okay.
So not massive. And the final thing is I want you to start tapering your antidepressants. You've made an appointment to see your GP to do that.
I've got
Okay.
an appointment on Thursday.
Fine.
Keep doing it. And keep doing it.
Good. All right. Let's go home.
I think Sarah's now ready to be slowly weaned off her antidepressants. She's beginning to see that there are other ways to treat medical problems than just pills. I wonder if that message will get through to Wendy.
And I must say, all my family had a headache the whole weekend, and they were like, there was no pills to take. We've got no pills, we've got no pills. And I was like, have a glass of water. This is where I think there was nothing in them.
Wendy's committed herself to the experiment I devised to see if her painkillers are really working.
Last night was about 80%. I took a pill. Today I took some pills, but I must say, I don't feel any pain at the moment.
She spent 2 weeks marking a chart I've given her to record her pain levels.
I woke up this morning about 80%. My neck is screaming, so I don't think there's anything in them tablets. Thank you. I'm sure the tablets I just took in the evening with placebos, because it's gone up a little bit. It's day 15, last day of the trial. I'm really worried that when Dr. Chris comes round, he's going to say we're just taking them for the sake of taking them. Hopefully that won't be the case.
If this proves Wendy's drugs aren't working, it means she's been wasting her time and money on them for the past 20 years.
Hello.
The pizza man.
How you doing? It's very nice to see you. I don't normally kiss patients, but you can have a kiss tonight.
Are you going to join all the dots tonight?
We're going to join the dots. All will be revealed. I've cautiously, optimistically brought a bottle of wine. It's very, very nice to see you.
Cheers.
So, I guess what I want to know is how has it been going the last few days?
Good. I've not been in a lot of pain.
Have you got your pill box?
Yeah.
You've written a little note in here. What does that say?
No, it's just like there's nothing in them ones.
But the rest of them, you thought there probably was something in them?
Yeah.
Can I draw the graph?
It's going to be all over the place.
Before I tell Wendy what's in the pills, I want to fill in her pain chart. The higher the dot, the more pain she's in.
It's not easy to join these dots, Wendy, because your pain is really variable.
Yeah, it is.
So why don't we draw on this, what we've done with your pills?
Interesting.
So the red is your paracetamol. Okay. And that went like this.
We reduced Wendy's dose of paracetamol over the first week, so she's had no paracetamol at all for 10 days.
Oh my God, I've had no paracetamol.
Since day 5.
It's been 10 days since you had a single gram of paracetamol.
Well, your pain was quite low on that day, wasn't it? Day 5.
Here's what we've done with your codeine. Okay, you were at 100% of codeine.
We kept Wendy at her full dose of codeine for the first week, and then reduced it gradually, so she's had no codeine at all for the last 5 days.
Today, I've had no paracetamol or codeine.
No.
None since
And
Monday.
yesterday you didn't have any, and the day before that you didn't have any. You last had a painkiller on Monday morning. You had 1 codeine.
You are joking.
That was it. That was the last painkiller you had. So the pills that you have been wolfing. The pills
oh my God.
You've had nothing.
I've had nothing.
I think what I was really genuinely terrified about is I would see your pain down here getting worse and worse and worse and worse and worse. And there is no way I can see that on that graph.
No.
So give me a hug. I'm so happy. I'm so happy.
It's a perfect demonstration for Wendy that drugs aren't treating her pain.
The road to salvation with that shoulder will be in exercising it and strengthening it.
Well, I'm never buying any paracetamol again, so the kids can go swing for it. Glass of water.
Thank you. Thank you for doing that. You've totally... Have a wonderful weekend. Bye, Jasper. So it's good, but the battle is only half won, because Wendy does have a habit, and I don't think it would take all that much before she went, you know what, maybe I'll go back and try those naproxen or those Nurofen, or might go back to the tramadol. She'd have another go. And so I have to prove to her fairly quickly that exercise and strength building is gonna fix her pain.
Wendy's attitude to her medications changed when I proved to her that they weren't working.
He'd need to come in himself to register.
And that's given me an idea that may help cut antibiotic prescriptions at the surgery. After all, I've failed to show how it can be done by taking a clinic myself.
In general practice, it's really hard to tell the difference between a bacterial infection and a viral infection. Viral infections don't need antibiotics, but bacterial infections, if you miss them and you don't prescribe antibiotics, patients can die, doctors can get sued. It's really bad news.
And the other difficulty I had was persuading patients that they didn't need them. Today, I've brought along something to solve both these problems.
So this brings the hospital laboratory to the GP's bedside, to the patient's bedside.
This machine will help me decide if they have a bacterial infection or not.
Come in.
I'm hoping it will help cut the surgery's prescription rates today.
Hi. You think you need antibiotics?
Yes.
Okay.
Because I've always been told that viruses should take 9 days in and out of your body.
This machine works by measuring inflammation markers in the blood. A result of over 20 means the infection is more likely to be bacterial.
CRP of 65. I think you might be getting some antibiotics.
Well, not an ideal start, but at least she needs them.
Hi, do you want to come in? It's quite a gang. Did you want antibiotics?
Yes, of course.
Okay. This is a test to see how bad your chest infection is.
Yeah.
As well as reassuring worried patients they're getting the right care, it will also give doctors peace of mind.
CRP less than 5. I would say on the basis of this result, you will only be harmed by antibiotics.
That's one course of needless antibiotics avoided.
Because what you have to do now is wait. Okay, so you're just going to get better slowly.
But none of my patients will leave empty-handed.
You can have a book, a DVD, honey, lemon. That's your prescription.
Thank you very much.
Don't eat all that honey at once.
Yes.
What's your name? Jake. How old are you? 12. All right, I am going to give you a prescription today. You're going to get a lemon. You're going to get some honey. And there you go, a James Bond film. James Bond, 1 time per day. Take 3 days off training. Okay. There's your prescription without antibiotics.
Of the 22 antibiotic prescriptions written out that day, my machine and I managed to stop 2. A reduction of nearly 10%.
And if we did that every day of the year, if we did that across the country, that is a massive reduction in the number of antibiotics. So I guess it's not for me to say the practice should take this up, but I think there is room for this.
I've arranged a meeting with the partners to see if they're interested in the machine.
The machine is somewhere about between £700 and £800. It's £4.50 a test. Is this a thing that you think you'd be interested in?
So first of all, there's the cost of the machine and who's paying for it. There's then also the cost of someone to either run the machine or the cost of our time doing those tests.
We're never going to be in the position where at our fingertips we have every test that you may wish to have.
The problem here is the doctors simply don't have the time or money to run even simple tests like this.
If I'm going to make any changes here, it has to be seamless. It has to be things that do not take any time. And it seems trivial, like, oh, it's global catastrophe, you can do your bit. And they're like, we're already doing our bit. We already prescribe carefully, and, you know, like hell, we're going to use your machine and run even later than we already are.
Wendy doing her exercises in a very limited space in the bedroom.
It's taken a while to convince Wendy to give up her painkillers. She's now trying a program of exercises to strengthen her back to see if it will help with the pain.
I mean, when I last saw Wendy, I threw away all her drugs that I'd confiscated. So I hope she hasn't had a wobble. None of you people are Wendy. Where's Wendy? There she is. Hi, Wendy. Come on in.
Nice to see you again.
How's the back?
It is better. I'm not in pain like I was before.
So that is what no one's ever told you, is that exercise is a painkiller for almost everything. Whether you've got knee pain or hip pain or back pain or neck pain, even if you've got a headache, exercise is a painkiller.
So for me to not take any drugs, I can't actually believe it myself. So I don't even take them for a headache now. I don't take anything at all.
I feel like I am leaving you in quite a good state.
Okay, well, it's our last consultation. Have a hug.
Oh my God.
Oh.
Thank you so much.
No. You've totally
really,
inspired
really
me. You've totally inspired me.
Everything you've done, I really have.
You have literally done the hard work.
Thank you so much.
Cheers, Wendy. Bye.
It's been an interesting journey. I'm really, really happy. I don't take any drugs at all. I'm exercising every other night. And I think I'm going to get better.
I think for 20 years, Wendy took drugs that totally distracted her and everyone else from finding the actual cause of the pain. What an amazing place we've got to with healing and medicine that we just go, take these pills. Wendy is the clearest example of the madness of the way we do medicine.
I'm beginning to make sense of the madness. Wendy's now off her drugs, and I'm hoping Sarah will soon start coming off the antidepressants. I'm more convinced than ever that drug-free treatments can work better than the pills. Next, I'm going to supersize my experiment to take as many patients as possible off drugs.
Keep up, everyone. Come on.
I try to get a group of patients at risk of a heart attack off their medication.
This is a disaster.
It is.
I take on the pharmaceutical industry.
This is a multi-billion-dollar industry. I don't know how we combat this.
And I discover just how hard it is to treat people without drugs.
But you need to make these swims like doctor's appointments.
Get your pills. Honest Pharmacy. We are selling pills with side effects guaranteed.
My name is Chris van Tulleken. I'm a doctor.
Gastric bleeding, sir?
I've been searching for solutions to a medical crisis that affects us all.
It can erode your stomach lining and then you bleed from your stomach, and it kills a certain number of people every year.
Every year, doctors hand out over 1 billion prescriptions. That's over 15 courses of medicine for every man, woman and child in this country.
So if you've got a headache, take paracetamol. If you've got a backache, take cocodamol.
Drugs certainly save lives, but this binge on medicines is dangerous.
That is an overdose. How could this ever be good for a human being?
Millions suffer side effects.
I was waking up depressed.
And thousands die every year.
Overuse of medication is one of the most serious problems that we face.
I believe there's another way.
Today is the last day that you are going to take these drugs.
I've been working at a GP surgery in northeast London, trying to treat patients without drugs.
You need to make these swims like doctor's appointments.
I faced worried doctors.
Stopping things could be downright dangerous.
And sceptical patients.
To just walk out with nothing, I wouldn't feel safe.
Now I want to use what I've learned to supersize my experiment and get as many patients as I can off drugs. I'll take a group of people at risk of a heart attack off their medication.
So, hand over your drugs.
But persuading Britain to go cold turkey,
this is a disaster,
could be the hardest thing I've ever done.
Fix me, please.
Intensely depressed about how to make a change.
Churchill Healthcare, Pat speaking, can I help? I've got the morning, morning's no good, is it?
Churchill Medical Centre is a busy GP surgery in Chingford, northeast London.
Who's up, mate?
Tina Hill? It looks infected.
I'm working with the doctors here to try and find ways to reverse the steep rise in how often we pop pills.
Take care, my love.
Right, cheers.
In the 14 years I've been a doctor, prescription rates have shot up by over 50%.
Thank you very much. Cheers.
Okay.
Kevin Wingrove.
Do you want injections? Do you want pills? Do you want an operation?
Drugs benefit countless lives, but they can cause side effects, from headaches to stomach bleeds. And our overuse is now a major public health concern.
Do you think we could just give you some nice fruit juice?
Yeah.
I believe we should be turning to new research that suggests many common illnesses are best treated without drugs.
Clean socks, clean feet,
Yep.
and keep them warm.
The doctors here think overprescription is a problem too, but they're sceptical about how likely I am to make a difference.
Very quick look.
It would be lovely to see if he could do it. I don't think it's going to be a walk in the park.
Nonetheless, I've been encouraged by a few successes. Wendy had been using medication for her bad shoulder for 20 years, and now she's drug-free.
For me to not take any drugs, I can't actually believe it myself.
Oh my God.
Oh.
Thank you so much.
No, you've totally inspired me. You've totally inspired me.
Everything you've done.
So far, I've been treating specially selected cases. But I want to make a real difference by offering drug-free treatments to all 14,000 patients at the practice.
Morning.
Good morning.
Today is the first day I'm going to run my drug-free clinic.
I'm offering patients 30-minute appointments, 20 minutes longer than they'll get with their GPs. The extra time will help me work out what pill-free therapies to offer them.
So I've put out my sign for the clinic.
All right.
I've got my 3 waiting seats upstairs. So if those seats are full, can you get people to sit out here, you know?
Cool.
The public will get the chance to choose me or see their doctors.
Neither of you are interested in coming to my drug-free clinic?
No. I don't understand how they could prescribe something and then not give a prescription. I don't get that.
So at the moment, prescriptions are an awful lot more popular than my non-prescription clinic.
Yeah.
Has anyone expressed any interest at all?
I don't know about out there, but not to me.
No one said anything all morning, and you've been here all morning.
I'm not sure where I'm going wrong.
Come in. Hey, Cam.
Dr. Cam Sira is a partner here.
So I'm trying to run my drugs-free clinic in the room upstairs, and it's not working, and I don't know why.
I think it's because patients, for want of a better word, want a quick fix. Society nowadays, you just haven't got time to do all the lifestyle changes. Basically, it's about motivation, and I think that motivation is gonna be your struggle, really. For a lot of people, it's easier to take that tablet.
How am I going to deal with this? What can I do?
You might actually want to target some patients who are on painkillers and some of the more common medications, perhaps antidepressants. Sometimes they're not as effective as the patient might think.
I've got some ideas on how to motivate patients, but first I've got to sign some up.
Shania, so I have some leaflets. The No Drugs Clinic, the Castle Reception. Appointment is room 9.
Perfect.
Good, all right.
No problem.
The receptionists have agreed to do some marketing for me to find the kinds of patients Cam's suggesting.
Cheers, guys.
For the last 3 weeks, I've been working with someone who's taking a drug I've been recommended to target. Antidepressants do help some people, but 24-year-old Sarah has been taking hers for 8 years.
I need my eyeballs by the end of it.
After I introduced her to cold water swimming, Sarah decided to give it a try in place of her pills.
How do you feel, Sarah? On top of the world.
Research carried out at the University of Portsmouth suggests that swimming in cold water could help treat anxiety and depression.
When was the last time you felt this good?
When my little girl was born.
Really?
Yeah, really.
But before she starts to come off her drugs, I want Sarah to be benefiting from swimming outdoors regularly. It's the weekend, and it's 2 weeks since we swam together.
Hey, Sarah.
Hiya.
How are you feeling today?
Pretty rubbish at the moment.
Yeah, I mean, you look almost tearful, if I'm honest.
No, you can't see. I'm not tearful.
Yeah, unfortunately the resolution is really good, and I can see your eyes filling with tears. I'm only laughing because you are. So how's the last week been?
Well, unable to get any sort of childcare, so I haven't been able to go swimming, which I'm quite upset about. I seem to have had a bit of a calm down.
It's hard, this, isn't it? Because
To put this in the starkest medical terms,
you have a medical problem for which you need to go and have treatment, and if you were going for chemotherapy,
if you were going for an operation, everyone would give you childcare, and I think this is no less important.
So yeah, so why could you not have gone today?
Today, I don't want to today. Yeah, that's the biggest reason why I don't want to today. Yeah. I'm miserable. I'm fed up. Yeah.
So you've lost a bit of momentum.
Yeah. Today, yeah.
What you're describing is the thing that screws us all up.
This is kind of the anatomy of failure. We fail one tiny, tiny, tiny bit at a time.
And we miss it 1 week, and then it's easier to miss it the next week, and then it's easier to miss it the next week.
But you need to make these swims like doctor's appointments, okay?
Just been a bad week.
All right.
Speak to you later. Yeah.
Okay. All right. Bye. I feel naive. I just feel like, oh God, I just thought we could dunk her in cold water and she'd feel better.
I'm hoping the pep talk will get her swimming, but I'm beginning to doubt my approach. But there's good news back at the surgery. After hundreds of phone calls, I'm starting to get interest in my no-drug clinic.
Crystal, come on in. Do you want a hand?
Please.
What do you want to get? I'll get the hand. I'll get the bag. Tell me what the issue is.
And pain every day, just kind of varying degrees. I've got it going up my neck. I get a lot of pain down my right side.
I mean, you're obviously in a lot of pain now, sitting here talking to me.
This is a good day.
What do you want in the broadest possible way?
I just want to be normal. I just want to work and live rather than feel like I'm existing.
Crystal's 36, and she's been like this for 3 years. Long-term or chronic pain is surprisingly common. 14 million people in the UK suffer from some form of it. But Crystal's case is extreme, and her doctors don't know what to do with her.
So there's nothing that anyone has been able to find, specialists or GPs, that explains why she's having all this really severe pain?
In a nutshell, no. And it's difficult to manage if you don't know where it's coming from.
Dr. Nashin Hamid is overseeing Crystal's care. Physiotherapy hasn't worked, and they're relying on powerful painkillers to help her.
Left to general practice, what would happen?
It would continue to cycle between a referral here, a referral there, back to us for a repeat prescription for the next 5-10 years. And that's sad, actually.
Nashin, thanks very much.
You're welcome.
I will go and try and find some way of doing this without drugs.
Well, good luck. All the best. Bye.
I'll keep you informed.
Thank you. Trying to get her off the medications is an amazing idea, but I think it's going to be a struggle. She's been on them for such a long time, and you know, they are controlling her pain to some extent, and I just worry that, you know, how is she going to cope without them?
It's estimated that millions of people live with pain that has no apparent cause. But for patients like Crystal, the suffering is very real.
I am not an expert in chronic pain, so I want to find out what is it like to try and live at home in that amount of pain.
Hello?
Hi Crystal, it's Chris. Here we are. Smiling but moving slow.
Sorry.
Don't be sorry. How you doing?
At the moment, not too bad. I have been known to come up here on my bottom.
Not dignified or comfortable?
No, none of this is dignified. And this is what I do. But I can't stay in that position for too long because my neck starts to hurt. I'm sorry, I took some meds a little while ago, so now I'm starting
You're a little bit
foggy.
slow and a little bit
Yeah.
foggy, yeah. Don't worry, give me the tour. You've got a feature wall.
Of course, changing rooms was my programme in the day.
Crystal lives here with her teenage son.
I was in the gym when I was first made aware that there was something wrong with my back. I was training for a 10k run, cancer research. They basically could hear my back, it was that loud, and came over and said, look, you need to go and get that checked out. And then within a short space of time, I just couldn't move or anything without screaming out in pain.
Crystal now spends most of her time trapped in this flat. She can't work, and she's only able to get out after elaborate preparation.
This is my corset. It just stops my back, or my tailbone, from feeling like it's going to pop right through the skin.
And she doesn't go anywhere without her neck brace. Today we're off to pick up her month's supply of painkillers.
So what's so bad about the bus?
Right now, exactly what he's doing, just braking, all of that I can feel is just bloody painful.
Hopefully they won't have run out.
No.
So is this it?
For today, you normally have 2.
Normally you have 2. It's heavy.
Thank you, take care, see you later.
I'm amazed at just how many drugs Crystal's picked up, and I'm worried what it's doing to her.
Let's spread the drugs out. That's the heaviest bit of shopping.
So I have my codeine, which is a pain reliever. I take 4 of those 4 times a day.
So you're taking 16 of these per day?
Yes.
That's a huge dose.
Codeine is related to morphine and heroin, and it can be addictive.
This one is the tramadol, and I'm taking that 3 times a day.
Okay, so that's a stronger version of codeine.
Stronger version of the codeine, and I take those basically together.
These drugs are called opioids. They're similar to pain-reducing chemicals produced by our bodies called endorphins. They cause side effects like constipation and nausea, and Crystal has to take even more drugs to deal with those.
If I was taking all of this and I felt pain-free, then I would at least feel like I was achieving something by taking this amount of medication, but I'm still not pain-free.
I don't get why you're taking these pills. I'm not sure you get why you're taking the pills, but is it just because there is nothing else to do?
Seriously, yes, is the short of it.
I'm pretty sure the answer doesn't lie in those pills, but rather in exercise and physical therapy. But at the moment, Crystal's so immobile, I'm not sure if she'll be able to do anything at all.
I feel positive because I think Crystal is at least willing to try and do the hard work, but I don't think she's got a clue about how hard this is going to be.
I need a swimming bag. Swimming bag would be a good idea.
It's been a week since I spoke to Sarah, and she's responded well to my pep talk. Today she's going cold water swimming again with her partner at a nearby lake.
I want that feeling back. It just gets on top of you when you suffer with depression. Everything builds up and you do need a stress relief. And antidepressants don't do that.
A bracing swim in 13-degree water will hopefully do the trick.
All goggled up. Do I look attractive?
It's the first time she's been in cold water since I took her swimming in Portsmouth over a fortnight ago.
How is it, Sarah?
Actually quite nice. A lot nicer than Portsmouth, but still quite chill. Right, I'm going to go swimming. See you in a bit.
Exposing the body to the shock of cold water can leave people feeling euphoric. Some scientists think it may even condition them to help deal with other stresses in their lives. But Sarah doesn't stay in very long.
Can't breathe. I started looking at the water and I started feeling like I wasn't moving anywhere. Yeah. That was horrible. I thought I was going to drown.
Tell me what happened.
I swam out quite far on my own, and then I think I had nobody with me, so I started to panic, thought I was going to drown, freaked out and swam back.
What can we do next? How can we make this so it isn't terrifying every time?
I think I found when I was in Portsmouth that swimming with somebody helped.
Right.
So I think, yeah, probably that would help.
All right, we will figure something out and I will get back to you, all right?
Sarah needs to just have someone to hold her hand in the way that doctors, nurses and pharmacists do when you start a course of prescription medication.
Drop down another inch. Good stuff.
I've decided to get Sarah a swimming coach to support her. She's been on antidepressants since she was a teenager, and coming off them can be hard. Between 2005 and 2012, the number of young people prescribed these drugs shot up by 54%. For many, the first step is filling out a simple form.
So I have here the PHQ-9 depression questionnaire, and this is one of the most common tools that GPs use in the UK and all around the world. So I'm going to see if I am depressed. So, the questionnaire. Over the last 2 weeks, how often have you been bothered by any of the following problems? Problem 1, little interest or pleasure in doing things.
So for several days, I have definitely had little interest or pleasure in doing things.
Number 2, how often over the last 2 weeks have you felt down, depressed or hopeless? I haven't felt hopeless at any point in the last couple of weeks, but I have felt down or depressed.
Some doctors use this test to help them prescribe and monitor antidepressants.
How often have you been bothered by poor appetite or overeating? I just perpetually overeat.
But it's also on the NHS website, allowing anyone to test themselves.
And then we add up the score. Based on your responses today, it's very likely you could be suffering from some form of depression, but only an experienced health professional can tell for sure. So according to this, I have moderate depression. And I'll tell you, I do not have moderate depression. The striking thing about this is that there is not a single positive question on it. Ask me some other questions. Ask, how often have you felt happy and positive about your life? Every single day. This is a questionnaire that does its best to force you to think about how miserable your life is and how unhappy you are. This is a questionnaire that was developed by a drugs company who make drugs that treat depression.
This isn't the first time I've noticed the influence of pharmaceutical companies.
Just looking around the office, Pneumovax 2. Well, we've got a little duck here, Sanofi Aventis, drug company. There you go, it just reminds you that you can use that flu vaccine. Sponsored by GlaxoSmithKline.
idea. This is a model of the female genital tract. You show the model to patients, and all the while there's a little branding there reminding you. It's just having the marketing here prompts people to prescribe those brands more. It's just the sort of the hidden hand of the pharmaceutical industry in the office.
And the marketing doesn't stop there.
The clinical meeting.
I'm on my way to a meeting the GPs are having at another surgery nearby. There's a lunch to go with the meeting, and the lunch is, we've heard, sponsored and paid for by a drug company. And this is completely normal, okay? This happens in hospitals and general practices all over the country every day. And my honest opinion is it is a total disgrace. And it's the only thing that I've yet heard about with this practice that makes me kind of wince. It's a bribe. It's a simple bribe. The drug reps provide the food, and in return they get an opportunity to talk up their latest products.
Where's lunch happening?
It's the second floor.
These lunches are a regular event.
Is it a good selection of sandwiches normally?
Yeah, Indian last week.
On the menu today, a selection of upmarket salads and sandwiches. I want to know more, but the drug company rep has a word with the GPs.
So just why the drug reps in here? Oh, you can't be called. You can be in here, but we can't be called while drug reps in here.
The rep gives his talk, and 10 minutes later he leaves.
Why do you have drug reps come at the beginning of the clinical meeting?
Be honest.
It's completely honest, yeah. Have you just finished the truth? Is that...
90% way through the trip. Yeah, I'm meeting the evidence. I mean, what they hope is it affects our prescribing data and the drugs they prescribe, and every doctor you speak to will tell you categorically it doesn't affect it.
The practice used the free lunch to get together and talk shop. But in fact, recent research shows that doctors are more likely to prescribe certain drugs if they take meals from drug reps.
So I went in there and I swore that I wouldn't eat any of the food. And midway through the meeting, I realised that I had started to eat a tangerine. We know it influences prescribing. The drug companies know it influences prescribing. This is a multi-billion-dollar industry with deep pockets and huge focus, and I don't know how we combat this.
First, I'll try to get an explanation from the drug company rep supplying the lunches.
Chris van Tulleken here. I just wanted to give you a ring to see if you'd be willing to have a chat with us on camera. Thanks very much indeed, and we'll speak soon. I'll bung you over an email this afternoon. All right, cheers, bye. He does seem like a really nice bloke. In principle, if the communications team at his drugs company are willing for us to speak to him, he's willing to speak to us. So that's really nice. Ask him some questions. So I'll write him an email now.
I'll wait for him to get back to me. Meanwhile, I've got an important appointment with chronic pain sufferer Crystal.
So we are going to see a physio who is a really, really good physio.
Okay.
Because I want him to assess you, because he works with a lot of people like you who have chronic pain. Have you got any questions?
No, not really. Just can we get there quicker? Yeah, I'm not knocking your suspension.
Getting appointments with NHS physiotherapists can take months, so I've had to go private.
Hi,
Hello.
Rob Madden. Pleased to meet you. How are you?
Nice to meet
Would
you.
you like to come down?
Yep.
Bend your knee up towards you again slowly. But yeah, it's hurting.
Crystal's previous attempts at physiotherapy have failed, but I hope this assessment will give me clues on the best way to treat her.
Oh my God, okay, now I've got upper body pain too.
Okay. You are doing absolutely fine. Yeah.
This is how I get up out of bed too.
Chronic pain can be caused by a range of things, from damaged nerves to joint problems. Even the way the person perceives the pain can play a role. But Crystal's pain is worse because she stopped moving and has grown weak.
Oh, Jesus.
You okay?
I need to find a way to build up her strength.
So what do you think? My outright concern is that at the moment
If you take her off her medications and ask her to do more physically, then there's a high chance that she could have a bit of a flare-up. So all of her back pain could actually get worse. My gut instinct is that she will struggle without medication.
So it's not just that my plan might fail, it's that I might make her much worse.
That could happen. We need to take small steps.
Rob wants me to get a second opinion. I still believe Crystal can get off these drugs. I do. I think her problems, a huge amount of her problems are caused by drugs.
It used to be called black gas.
I'm meeting Dr. Kathy Stannard at an exhibition containing some of the earliest forms of pain management.
Oxford vaporizer, portable self-contained ether vaporizer for use in battle conditions.
Dr. Stannard is one of the country's top consultants specialising in chronic pain.
What do you think, in general, your totally honest, blunt opinion about what I'm trying to do, about my attempt at a drugs-free clinic?
Well, actually, in evidence terms, it's really sensible.
Really?
Certainly in pain, that makes sense. We know that medications aren't the answer. There is no evidence for effectiveness of opioids in the long term.
And there's no evidence that they work at all?
There's no evidence. So even with somebody with long-term pain, if you start off, they may well work for 4 to 6 weeks, but after that they will stop working.
What proportion of people are harmed? Because you're saying we're giving out more and more of these kind of drugs in this country.
I think it's difficult to put a figure on. What we do know for sure is that about 80% of people taking a drug, taking an opioid, will have at least one adverse effect. But what we also know is that there are some more serious harms that are associated with high doses over longer periods. So, for example, disruption of hormones, changes in the immune system.
Really?
With long-term exposure, the drugs can actually make pain worse rather than better.
Hi, Crystal, it's Chris.
Dr. Stannard agrees Crystal should try and come off the drugs if she feels able. She and Crystal's GP have made a programme to wean her off them safely.
Today is the last day that you are going to take these drugs in the way that you've been taking them.
This won't be easy. Cutting down means that Crystal may have unpleasant withdrawal effects.
The tramadol and the codeine, they're addictive in the same way that heroin is, that morphine is. So we need to taper these off so that coming off them isn't worse than staying on them. So phase 1 is tapering, but we're not just going to do that. We want to actually try and fix you as well.
Over the next few weeks, her doses of drugs will get smaller and smaller.
Cheers, Crystal. I will see you soon.
Thank you.
Bye.
I'm also going to have to find a long-term solution that really works to take the place of the drugs. But first, I'm turning my attention back to putting a stop to the lunches at the surgery, paid for by the pharmaceutical industry.
You might think I'm getting a bit worked up about a few sandwiches given out at a GP's practice in Chingford by a pharmaceutical industry rep. Not a big deal, small beer. Let me show you why I'm getting worked up. Okay. Over the last few years, the drugs industry has paid $13 billion in fines in the US alone.
The fines are for a range of unethical activities, including bribing doctors to prescribe their drugs. While the lunches drug companies buy are perfectly legal, I'm uncomfortable with them having such direct access to our doctors.
We get amazing drugs from them, but anyone who thinks that a representative from a drugs company is going to give totally independent, unbiased information about their product is frankly insane.
The drugs rep has been told not to speak to me. So I've come to the Association of the British Pharmaceutical Industry, a body that represents drug companies in the UK, to speak to Dr. Virginia Atcher.
We have filmed an awful lot of pizzas and sandwiches and soft drinks and apples and packets of crisps that are given out by pharmaceutical industry reps. And that really concerned me.
And it should. So we do have a code of practice. So if there was evidence being presented there, it should be proper scientific evidence.
So you're comfortable with your NHS GP being educated by
someone who is employed directly by an industry that is selling drugs?
So I would be concerned if my GP was not aware of all the different treatment developments that were happening. But what's interesting to me is the people who really get informed at those meetings are the very same company representatives, because they're hearing questions that perhaps were not thought through when the company was putting together whatever material needed to support it, or there's an insight about how care could be better delivered. If we don't have that feedback from the doctors about the quality and impact of a medicine, there's no signal to the system to have a look at a medicine and consider, is there something here that we should be looking at?
Thank you so much. I'll let you go.
I accept we cannot develop new drugs without industry coming into contact with doctors and patients. But they're still influencing prescribing, buying doctor sandwiches. It's not good. And even a sandwich changing hands, I think we could avoid that. I think we could just get rid of the sandwiches.
But the only way I can make that happen at Churchill is by persuading the partners to stop taking the lunches.
I'm really amazed, I guess, that you have drugs company sponsored lunches.
Why?
I guess maybe it feels like we're at a point in medicine where we know it's bad. And it doesn't square with anything else that I've seen in this practice.
I mean, if I take you back to when we first met you, you know, you wanted to get everyone together, so what did you do?
I bought you all sandwiches.
Absolutely. Because if there's one way you can get people together, it's provide something that makes it worthwhile they're coming.
Well, maybe I'm no better. But to turn that on its head, the person who should be criticised here is you for accepting my sandwiches. Because it is a bribe.
When I first started, I had an offer of a conference in a ski resort. It was basically a ski holiday, right? And so we've gone from there to once a month having a couple of sandwiches.
Okay.
We constantly sent leaflets and invites to evening meetings at very nice restaurants.
The doctors only take the lunches, and they're adamant it doesn't affect their prescribing.
The problem is that's what all doctors say, isn't it? We all go, well, yeah, I'll eat the sandwiches, but I plug my ears for the talk. But we know that that isn't what happens.
Sometimes you don't look at things, right? So you're just used to doing things in a certain way, and it takes someone external to come in and say, have you thought about?
I hadn't understood how much they turned down. And all my kind of anger and outrage is probably a bit misplaced. However, we will make Churchill a pharmaceutical industry-free practice. Following our meeting, the partners decide not to accept drug company lunches anymore. It's a small victory, but my ultimate mission is to get as many people as possible off drugs.
Chris.
I soon have a patient at my no drugs clinic who presents me with an excellent opportunity to do that.
Well, I was told that there's alternatives to taking medication for things like blood pressure, diabetes. So I'm quite interested in that.
69-year-old Mike is taking 10 tablets a day.
So you are rattling, aren't you?
Yeah.
Are you a well person or are you an ill person?
I do keep fit. I do 2 stamina swims a week.
You're a fit man that we're just giving. I mean, look, there is something really weird about this pile of pills for someone who is well, who's never had a stroke and never had a heart attack. It's all about preventing stuff.
Mike's pills are for high blood pressure, high cholesterol and type 2 diabetes. But I don't consider these diseases. They're simply conditions that put him at an increased risk of having a heart attack or a stroke.
Do you get side effects from any of the tablets?
You do. You can get quite dry mouth and certainly pain in the eyes. Now, the pain in the eyes comes from the blood pressure one.
Do you want to take all the tablets?
No. I don't want to take any.
Yeah, great to see you. Good, and I will see you soon, Mike.
There's no way that we like taking pills and you're thinking, oh, not another one. Is it going to end? Or is this it? Is this what it's all about when you get old?
Mike's drugs are the most prescribed drugs in the country. NHS guidelines prompt doctors to put millions of people on these sorts of pills. It's a big issue, and I need advice on how to approach it.
So we're with you.
Professor Sir Muir Gray used to be the Chief Knowledge Officer of the NHS.
Raised levels of cholesterol, raised blood pressure levels,
You'll notice I'm not using the name of diseases. A raised level of blood sugar, type 2 diabetes, and this is really where too much medicine has focused. But what these people have got, in my view, is they've got the problem of the modern environment. They've got walking deficiency syndrome or hypersitting syndrome.
Muir thinks there's a simple way to treat these conditions caused by modern life.
I would spend a lot more money on giving people support for exercise, and particularly physical exercise. I think we as a medical profession have completely underestimated. And last year, the Academy of Medical Royal Colleges, which is a very august body, produced a report called Exercise, the Miracle Cure. I never thought I'd see that in my lifetime.
A lot of the doctors say, but we do. We tell people to exercise, and they come back a month later and they've done no exercise, so they have to have a pill.
Giving people supported programs, not just giving them a bit of information or a bit of paper, that giving people support can be as effective or more effective than medication.
In our healthcare system, most patients are just told to exercise rather than supported through it. I want to use Muir's advice to help patients like Mike with a programme of supported activity. I just have to figure out how. Crystal's been slowly coming off her painkillers. She's discovering how awful coming off opioids can be.
Day 4, I have been on the loo for pretty much most of the night.
Diarrhea and insomnia are common withdrawal effects.
Feeling pain, feeling it even more in my upper body today, but I'm guessing that's because I've not had much sleep. I'm really struggling today. I'm pretty hot at the moment too. Today really sucks.
Crystal will also need supported therapy if this is going to work, and I've found something unusual for her to try.
Crystal.
Hey.
Thanks for agreeing to meet me.
That's okay, I'm glad you're here.
You all right?
I'm very shaky.
You're looking a little shaky,
yeah.
But you are going to be just fine, okay?
Yeah.
Let's go.
The man I'm taking her to meet is an expert in pain.
Crystal, this is Dennis.
Hi, I'm Dennis. Hi, nice to meet you.
Attention. Okay, go straight to your butler.
Dennis Ngo is a Kung Fu master who's been teaching for nearly 40 years.
Stretch your groin, keep your body upright.
So the logic about why we chose this kind of Kung Fu is because it's exercise, it's slow. I think more than anything else, we all believe, the team of people that have talked about you, that this can get inside your head and deal with your body.
Yeah. Many martial arts aren't just about combat. They focus on breathing, posture, mindfulness, and they condition practitioners to deal with pain.
Number one thing, don't tick off Dennis, okay?
Shift, up.
Dennis will see Crystal privately for a few lessons before she joins the class.
Thank you. How much do you want to get out of this?
Everything. I really
want.
Yes.
We take someone like you and we build them up very slowly. In.
I'm taking Crystal into uncharted territory. There's no established scientific evidence that Kung Fu will work.
Oh, I know. Okay, stay there. Come on.
But Dennis has a deep knowledge of the human body.
Gyrate it very slowly. The other side. Go.
Oh, shit.
I need you to actually push a little bit through. The one thing I need you to do is not to search for pain. A lot of people who has pain, they look for the pain instead of allowing the pain to arrive. So allow the pain to arrive if it does. If it doesn't, be surprised, be happy. Okay? Oh. Look up, look up, look up. Yeah. Keep your back straight, look up. That's it. I'm going to stretch your back.
Crucially, I think Dennis will inspire Crystal to accept that this will be a painful road to recovery.
Good. It's good pain, it's good pain, it's good pain. Yeah, it's great.
He's the real deal, isn't he?
Yeah.
He spoke more sense about pain
than I think almost
That's why
any
I said
doctor
I
I've
wanted
ever
to
met.
take him back with us.
I'm hopeful these classes will help Crystal. But even if it works, it is hard to imagine GPs adopting Kung Fu as a treatment plan. However, I've come up with something simple that Churchill's doctors might be able to use in place of a huge number of their prescriptions. I've arranged to meet Mike and a group of others who are taking drugs to lower their risk of heart attacks and strokes. There are thousands of patients like them at the surgery, and this group would like to stop. Hi everyone, thank you for coming. Sorry I'm late. Just as a straw poll, how many people here have had side effects? Okay, so 6 out of 9 people. So I have a treatment that will reduce your risk, not just of having a heart attack or stroke, it will also improve your mood, it will reduce your risk of all kinds of cancers. It is essentially a miracle cure and it is side effect free. So my proposition...
What's the catch?
The catch is, there is no catch. It's literally a total win, okay? So the proposition is 5 times a week for 30 minutes, we're gonna go for a walk, a brisk walk. What do you think? There are a few slightly sceptical faces around the group. I think we're going to have to see how this goes. Okay, right, I will lead on. Keep up, everyone. Come on. Something tells me this won't be a walk in the park.
I just hope I've got the motivation to keep doing it.
It's commitment, it's fitting it into my lifestyle.
We can all step out the door and go for a walk, but you sit in the chair instead, don't you? Because there's no one sort of making you do it.
They may not be so keen on walking now, but once they experience the benefits, I hope they'll be converted. Research has shown that walking regularly has astonishing healing powers, from reducing obesity to cutting the risk of cancer. I want to see what effect walking will have on the conditions they're taking drugs for. So we're measuring their blood pressure, their blood sugars, and their weight. Patient number 1, Michael.
Hello.
I'll take these measurements again when they've done 8 weeks of walking. We're also stopping a drug they've all been prescribed called a statin. It lowers cholesterol, and I want to see if walking can do the same job. This is the entire NHS budget.
Then you press the space bar.
I'm being helped by Catherine, a senior nurse who manages their medication.
Do you think we're going to be able to relieve your workload a little bit by getting people walking?
Realistically, no.
Why?
I've seen people can achieve great things with motivation, but something happens in their life and they get off track.
People get easily derailed.
I'm hoping the fact they'll be walking in a group and that I'll be supporting them will make the difference. Sarah's treatment of cold water swimming has shown me how some patients need support to complete their therapy. She struggled to go by herself, so I arranged a swimming coach to help her. I want to see how she's getting on.
It's just like the country.
We are in the country.
It is the country.
Sarah's now been swimming regularly for a month.
Thank you very much.
Tell you what, everyone else is in wetsuits.
Yep.
But not us.
Nope.
I haven't got depression. I don't see why I can't have a wetsuit.
Everyone else is wearing one. It's not 19 degrees.
When Sarah first started, she could barely swim 50 metres on her own. Now she's training to swim kilometres.
Oh. So you've come a really long way.
It's brilliant. I can't describe it, but it's lovely. I find it, if I do have a low with anything or I'm having a particularly bad day, I find if I come here, it solves it straight away.
Really?
First, darling.
I'm hoping the swimming has been a catalyst for positive changes in her life.
Hello.
The last time I came here, Sarah's house was full of clutter. A lot of it belonged to her brother, who died just over a year ago. Look at this! I mean, wow, right? So last time I was here, you could hardly get around the bed. This is like a different room. It's really nice. You're in the room of someone who's got a kind of organised life and an organised head and someone who's got their act together.
Yeah, that's how I feel.
She's now working with her GP to wean herself off her antidepressants.
I'm on 20 milligrams now.
Oh, hold on, and you were on 40?
I was on 40.
So you've halved?
Yeah.
Okay.
Yeah, I feel a lot more energetic. It's nice. I feel a little bit more me.
Evie, how's Mum been?
Yeah, you've been all good, isn't it?
Sarah's still got some work to do, but she's now on the right track to getting off the antidepressants for good.
In Sarah's case, lasting happiness is going to come from exercise, diet, friendships, her job, the way she's bringing up Evie, her relationship. That is what you can't put in a pill, and that, I think, in Sarah's case, is what the drug was stopping her doing.
With Sarah doing so well, I want to see how Crystal's getting on. 12 weeks ago, her chronic pain left her barely able to move, despite taking 30 pills a day. I've adopted a radical approach to get her exercising: Kung Fu.
There is no good treatment for chronic pain. So if we've made a dent in it, and at least she's not on pills that she hates and that were causing her side effects, that will be good. I'm nervous.
This is the first time I've seen her in over 2 months.
Oh my God. She's standing on one leg. She's smiling. She's laughing.
She's moving. I haven't seen her wince or hold her back or...
Hello. How are you? I'm sorry, I'm smelly and sweaty now. Look.
So I was just watching you the last little bit from outside the door. I'm completely blown away.
Oh, cool. But I've worked bloody hard, to be honest, to get here, and Dennis is a pretty good drill sergeant.
How has it been?
I've been very, very proud of her. Very. She wanted it. Honestly, she wanted it. No one can get her to do what she does if they're not ready. And she really wanted it. Yeah, I
feel like a good student.
I'm very proud of you.
Thank you so much, much appreciated. It's learning to stand, learning to walk. Even the slightest thing, you know, Dennis will come around and say, your head's not straight, and do that, and I don't even notice because it's what you're used to. So it's been good. Don't get me wrong, I have bad days still, but not like I had before.
I just think you are the poster girl for what harm drugs can do and how there are other things you can do apart from taking pills.
Yep, no pressure.
Give me a big old hug.
Thank you. Sweaty hug.
Dennis, give me a hug.
Crystal's transformation shows that exercise really can be a miracle cure. It benefits the whole body, from the brain to the bones, enhancing its ability to heal itself. But bringing this miracle to my walkers is proving hard.
So is this normal, that it's just 2 people?
Well, it has been for the last 3 months.
This is a disaster.
It is.
Oh, is that Sophie? It's Chris here. I know you're not being lazy.
I'm determined to make sure the group gets the support it needs to thrive.
Sprikey! Sprikey!
This walking programme could easily be rolled out at the surgery.
Sprike, my mother-in-law's dog.
Thousands of their patients are on medication to lower their risks of heart attacks and strokes.
That's no way to say hello. I'd say once he gets going, there's a lot of momentum.
But I've got to keep my test group walking regularly so I can demonstrate the benefits.
You're going a bit faster.
5 walks a week, 30 minutes a day is all it takes.
2 miles, pace 15.37.
My pain in my leg's gone though, you know.
Has it?
When I used to kneel down, I could never get up, but it's gone now. I can't believe it.
What I said at the beginning of this, walking is a miracle cure.
They're certainly feeling the benefits, but has the walking lowered their risks of heart attacks?
Michael Smith?
The 8-week experiment is over.
Ouch.
There's always one. Come in, have a seat.
Before the group started walking, they had their baseline measurements taken for various conditions they have,
Mummy's big and brave.
from type 2 diabetes to high blood pressure. They even stopped taking their statins so we could measure the effect the walking had on their cholesterol levels. I'm nervous about the results.
Hi, Catherine.
Hi, Chris.
You got something for me?
I've got the result.
Lordy, lordy.
It's good news. The blood sugar levels of the walkers with type 2 diabetes have changed dramatically.
His HbA1c. This is the measurement of how good his diabetes has been over the last few weeks. It's now 57 from 75.
Which is fantastic.
I mean, is that a good result?
It's
You've seen this
really
the whole
good.
time?
Yeah.
Is it?
Absolutely.
Oh, I'm so
I'm very pleased with that.
It's an effect seen across all the diabetic walkers.
Her HbA1c has gone from 56 to 48. And 48 is kind of the sort of minimum that gets you to be called a diabetic.
Yes.
So actually, she's starting to come toward, you know, stopping being diabetic. I mean, that's in 8 weeks.
Which is really significant. It's better than some of the new drugs say they can do in a few months, isn't it?
Not only that, the walkers' blood pressures dropped, they lost weight, and even their scores in mood tests soared.
37 to 51.
It's massive.
I mean, that is massive.
If the group keep this up, there's a chance they'll be able to cut out the drugs they're taking altogether. Now they feel the benefits, they're motivated to carry on. And even though their cholesterol levels remain high, none want to start taking their statins again, preferring to try and lower their levels naturally. But Mike has the highest risk of having a heart attack, and taking a statin again is the quickest way to reduce it.
So this is quite an interesting chat that we've got to have. You're at a level of risk where I start to go, maybe I would take a statin. You have reduced your risk by losing weight. You have reduced your risk with blood pressure, but your absolute risk is still high.
Well, what comes to my mind is, let me do a 3-month trial and do another blood test and see what the results are. So when you've got the opportunity to come off a pill, it's like coming out of prison, you know, you're being released. You're feeling different in your mind, a bit younger.
I decide to take what I've found to the doctors. I hope they'll be as impressed as I am by the blood test results.
So you guys don't know the results?
We don't know it, no.
Mike, I guess, had the biggest result where his HbA1c went from 75 to just over 50.
That level of reduction, so that's quite impressive.
So that is really good.
We don't always get results like that with drugs as well.
Did they lose weight?
Every single person lost weight, yes. Walking as treatment for diabetes, as a way of reducing your risk of strokes, heart attacks and death, suddenly starts to feel like, oh, that's really good.
If within the practice we have a diabetic walking group set up, to me that's absolutely fantastic and something the practice should be supporting.
I'm so pleased that they feel it did pay off. I mean, imagine if GPs all over the country were able to support patients like this. You know, we'd see reductions in medications for blood pressure and cholesterol and diabetes. But I think there's something much more important than that we really saw with Mike and Janet particularly. All these things it's hard to measure. Their mood improved, they slept better at night, they felt like they were in charge of their own health and their own bodies. You can't put that in a pill.
I'm at the end of my time here, and I now realise the real problem isn't simply the drugs, but our healthcare system itself. We hand out pills when often we should be supporting people through drug-free alternatives instead.
If you say, I want to go walking, your doctor says, well, go walking, and that is it. Where's the support? We all know that we won't do it. The health service, if it is to be a health service and not a drug prescription service, needs to be able to support people doing those difficult long-term but ultimately massively rewarding and health-giving
things. In just a few months, I've witnessed extraordinary transformations as my patients have turned their backs on drugs. If we can empower doctors across the country to help millions of patients do the same thing, then in the future, prescriptions could mean something much more powerful than just pills.